Sometimes in your life you really need to get a tooth extracted, and it's probably for the betterment of your overall health. But one of the complications that could occur after a tooth gets extracted is something called a dry socket. And that dry socket is something that causes fever, swelling, and usually extreme pain. Hi, I'm Dr. D. In this video, I'm going to be talking about dry socket, what it is, and 6 ways that you may be able to prevent one of those unfortunate circumstances to happen to you. So here goes. So what actually is a dry socket? A dry socket is an infection of the bone surrounding the former root of the tooth that was just extracted, and it's most commonly found in your wisdom teeth. When you get a tooth out, you create an open wound, so of course you're going to bleed. The blood normally will fill that space and form a clot. If that clot is dislodged before it forms tissue, though, the bone will become exposed to the air. This may not sound like a problem, but the air can invite bacteria and other microorganisms in, which can cause inflammation, infection, and severe pain. Preventing that clot from dislodging over the first few days is your chief goal, and I'm going to show you how to do that. The first thing is to make sure you bite down on the gauze pads the dentist places until you get home, as they are going to instruct. Hopefully they gave you additional gauze pads to take with you as well, but if not, you can pick some up at your local drugstore. If you're numb, you may not feel much in the area, so it's important to just take a look visually at the gauze every 5 minutes or so to see if you're still bleeding. If so, change that gauze pad and bite down again. Do this every 5 minutes until the main bleeding is stopped. But be gentle when you take out that gauze, though. You don't want to pull out that clot. Your second tip is that while many may suggest initially applying cold to reduce the swelling, you should apply heat in the first hour instead. It'll increase your blood flow and kickstart your body's natural healing powers. If swelling continues after an hour, alternate heat with an ice pack to bring that swelling down. A few minutes with each to do the trick. The third thing is that if you find yourself still bleeding after a while, bite down on a cool, wet tea bag. Black tea is preferred, and place it on the socket as you did with the gauze pad. Believe it or not, the tannin in that tea will help stop that kind of bleeding. As an aside, remember to put a towel on your pillow when you go to sleep in case you're still oozing blood and you don't really want to ruin your pillowcase. The fourth suggestion is not to vigorously rinse your mouth out for the next 24 hours. If you must rinse, please be gentle. The liquid movement could suck out that clot and reopen that wound. If you had a bad taste in your mouth, try rubbing some alcohol-free mouthwash around your teeth and gums with your finger. You'll feel better. Next, do not smoke at all. The act of smoking creates a suction in the mouth, which can pull out the clot. Additionally, it reduces circulation and slows down your healing time. As well, do not suck through a straw, because that could add additional suction, which may pull out that clot as well. Finally, rest. Take it easy. Getting a tooth out is traumatic and your body needs to heal. No heavy exertion. Take a day off from the gym. All in all, the gum should begin to close up after 7 to 10 days. So there you have it. 6 ways to prevent getting that dry socket. I hope you found this valuable, for if you ever have a dry socket, you're never going to forget that experience. I must advise you, however, that if you continue to get severe pain, increased swelling, uncontrollable bleeding, head back to the surgeon immediately. If your surgeon is not available, head to the nearest emergency room. Thanks for watching, like us, and don't forget to hit that subscribe button. So long, and see you soon.